Hi, I'm April Don-Chinsky. I'm the Chief Communications and Marketing Officer for the Marfan Foundation, and I am so happy to be with everyone today once again for Know, Connect, Thrive, our foundation podcast. We are delighted to be joined by Dr. Kim Eagle, as ever. Hi, Kim. How are you?
Thank you. Nice to be here.
And Stacey Watson, the director of the Loeys-Dietz Syndrome Foundation, and also a person who lives with Loeys-Dietz syndrome herself. Stacey, thanks for joining us today.
Thank you so much for having me. I'm so excited to be here.
Great to be with you. So we have super exciting news today. Many of you are aware, many may not be aware, that the Loeys-Dietz Syndrome Primer, as it is called sort of affectionately and informally, has been updated to benefit our community, to help people better understand their condition type, their variants, their diagnoses, and to participate in shared decision-making with providers. So Kim, I'm going to turn to you first. Talk to us a little bit about the generalities of guidelines for folks like you, for doctors, for researchers, for scientists. Why do guidelines matter in a broad sense?
Well, I think that guidelines become the anchors of clinical practice. They synthesize. I mean, there's a whole world of research out there and investigators around the world fighting disorders like Loeys-Dietz. Some of that research is immediately applicable to clinical care. Other research may be preliminary. And by getting top experts together to review the latest in science and condense that into a manageable format that can be used by patients, families, and providers to provide what we would consider state-of-the-art care is really important. And especially in a disease area that is moving rapidly, both in terms of genetic understanding, potentially therapy, et cetera. The presence of guidelines in the literature is really important to our community.
Stacey, from a sort of a family perspective, patient perspective, community member perspective, do people print these sorts of guidelines out and take them to appointments? How do they work in practical terms?
Yes, absolutely. And we really encourage people to do so. Unless you're at one of our, centers of excellence, one of the institutions that are really a part of the foundation's institutional directory. We know that there are knowledgeable providers out there, but it's great to come feeling empowered, like you have a tool in your toolkit, something to bring with you to help your clinicians, your providers understand kind of where you're coming from and what the standards of care are for people living with these conditions, living with Loeys-Dietz and all of our different subtypes. So coming prepared will really just arm you with the confidence when you go into your appointments to be able to speak to kind of what your experiences is and what the people who really know and understand these disorders best recommend in terms of care and treatment.
So, Dr. Eagle, if I'm hearing Stacey right, it sounds like these guidelines aren't just for expert providers. They're for an example, a family internist that maybe sees one Loeys-Dietz patient in a lifetime. How are they useful, new guidelines and primers and things of this nature for, really great providers who may simply not be experts in genetic aortic conditions?
Well, I really agree with Stacey that around rare conditions, having our patients and families be their self-advocates for access and excellence in care is really paramount. And hopefully, if they're seeing a provider that is open-minded and understands that they can't be an expert on everything all the time, they're open to this sort of give and take that happens between a patient and a provider over a period of time when they're getting their care. And honestly, sometimes the patients and families actually know more than the provider does. And if you're seeing the right kind of provider, they're open to the notion that I'm not all knowing. And I'm facing a rare problem that maybe I've never seen before, or a variant of a problem that I've never seen before. And I value the fact that this patient and family has knowledge that we together can apply to an appropriate strategy for diagnosis and treatment and follow-up. That's the goal. And I think when patients and families approach that in the right manner, providers for the most part, embrace that and actually admire it.
Yeah, that's wonderful. I mean, we'll talk a lot about shared decision making in a bit, and that sort of sounds like the precursor to really good shared decision making between providers and patients. So let's talk a little bit about timing. Kim, can you give us a sense of, why are guidelines updated and what is the cadence and sort of frequency? What drives some of that in the scientific world in general?
So, guidelines are developed based on broad bringing together of the latest science. Some areas in medicine don't change very often. And so the guidelines surrounding that particular area may be spanned over years and years.
Hmm.
Other areas are changing rapidly. And um, the appropriate entities that create guidelines are watching what's happening in the world of science around a condition and saying, okay, is the framework that we used to use for this condition last year or the year before, is it still relevant?
Hmm.
Or have there been important updates to that really need to be incorporated into documents that we sort of consider to be the scaffold for care? Guidelines, they're not prescriptions, but they're a general scaffold upon which we base our care patterns for a given condition. So it's really the pace of change in the science that should guide how the guidelines evolve. And honestly, some entities are a little slower on their feet than others. Critics of, say, the American College of Cardiology and the American Heart Association guidelines, those guidelines sometimes seem very tedious to create, and you've got two big organizations that are fighting about, okay, is this an update that we really need in there? Other organizations are lighter on their feet and they move more quickly. And it's just that's the world we live in. But really, hopefully, the pace of science and how quickly areas are changing will guide the right cadence for guideline updates or complete rewrites sometimes.
Stacey, that makes me kind of think of the cadence and speed of the questions we get from community members. So, can you tell us a little bit about, prior to the primer being updated, some of the kinds of burning questions community members were presenting that we know this primer is now going to help solve for them and their care teams?
Right. So the previous primer really focused on the cardiovascular system, the vascular system, and imaging around that, and had some guidelines around orthopedic care and like scoliosis and pectus and things like that. We were getting a lot of questions beyond that, questions about quality of life, a lot of questions about women's health, a lot of questions about, other kind of systemic issues that people would have, like headaches. And the new update to the primer really addresses all of these things. It talks about how things to keep in mind, and it even has a table of all of the potential features that we see with the different subtypes of Loeys-Dietz and kind of the frequency in which we see them in the different subtypes. I should
Hmm.
also add that the previous primer didn't include LDS types really 4, 5, and 6. And the new the new primer has guidelines and recommendations for imaging and care for those types. So yeah, we would be getting questions through our Help and Resource Center about what can I take to help with my headaches, like what's safe.
Hmm.
And this guideline, these primer, excuse me,
It's okay.
the updated primer has really great information, not just about how to take care of yourself beyond the cardiovascular imaging and the orthopedic imaging and things that you want to be aware of. But it talks about women's health. It talks about medications that may be safer than others. And it just provides a lot more information for people and even for people in the community and for our team to help answer questions and to help steer people in the right direction.
Well, that is awesome because we certainly want to have the most up-to-date resources available for our community members. So, Dr. Eagle, talk to us a little bit about some of the nuance here, right? Why is it so important to understand the most common traits related to a particular variant or subtype? How does that impact care? How does that impact diagnosis?
Well, obviously, the areas that we're talking about with Loeys-Dietz, each of the genetic footprints will have a constellation of organ system involvement that matters to patients and families. And understanding that, understanding the frequency, the shared experience about how best to manage, looking for problems that maybe a family member needs to know about that could be in the future, things like that really matter. And something Stacey mentioned that I think is really important is that this primer has whole new categories of genetics for Loeys-Dietz. It has shared expert opinion about management of conditions where we may not have a big registry or a big clinical trial, but the guideline writers or the primer writers, they're experts. They see these areas, these problems all the time. And their shared experience living in a document like this allows the patients and families to get, I think, the best we have currently in terms of the constellation of findings and how best to manage. And you want to see an expert. You're getting expert opinion in this primer, even if you're living in rural Montana, where you may not have a clinic that could possibly give you this kind of resource.
That is so exciting. And on the topic of sort of excitement and energy around this, Stacey, if you just put on your hat as a community member for a minute, aside from being the director for Loeys-Dietz, what sort of excites you about this? Having so many friends and family members who are impacted, what's sort of riveting to know that this is now available?
Gosh, that's such a good question. I would say what excites me the most, honestly, it's not just about the care that I am going to receive. It's knowing and having the confidence that I can go anywhere with this as a tool. Because look, I am so lucky to live near a center of excellence and receive care there. But we know that things are always changing, right? Doctors move, and with them, sometimes expertise moves, and insurance guidelines and insurance like coverage can really change from being completely covered at one center of excellence to not. And I have personally had that experience. So knowing that I have something to take with me to help back me up in what I know and feel is the right path for my care, it's really, really exciting. And I'm just going to add that it's kind of nice to know that I can send people to the primer itself instead of having to be the like know all be all for
the source of all
for
things
family and friends.
Loeys-Dietz.
Yeah, and I love that they trust me and they come to me with these questions, but I really want to empower people to have this information on their own. And we were talking a lot about shared decision making, and also what this primer does is really emphasize the individual. And it says, like, this is what we see as a trend with this variant, with this subtype, but your experience might be different. So you want to consider all of these things when making a decision. And so those things are really, really exciting to me. I think that this primer is really modern in its language around that. And it leaves room for that shared decision making. And it's not saying this is the right way, that's the right way, this is wrong. It's saying, look at all of these things, make your decisions with your team accordingly.
Let's dive into that shared decision making. We're seeing it in a lot of places, right? We just saw it with updated physical activity resources. You're kind of seeing that as a trend across medicine. Kim, can you give us, for average folks that aren't involved in this day to day, what is the difference maker nowadays that has sort of awakened the medical community as a whole to the fact that every single community member, every patient is unique, may present differently, and may have, when it comes to their total sort of well-being package and what makes them feel whole and that their quality of life is great, that's about shared decision making, not just cookie cutter approaches based on a chart.
Well, obviously the fact that we're in a digital revolution and patients and families have access to the same information that their providers have. And sometimes I think you could argue they have a lot more time to understand what is actually out there in terms of knowledge and or experience that could be brought to bear on their illness or a loved one's illness. So they are armed with the knowledge that's available, just like providers are armed. And this, of course, is very empowering because
Yeah.
especially if they're confronting a provider who is not well versed in a problem that they have. I think the empowerment that the primer provides our patients and families is immense. And it gives them a foothold to discuss the give and take with a provider about, okay, this is what we know, but based on the knowledge of the world's literature condensed into this primer, let's think about my situation and how together we navigate my problem. And, whether that's blood pressure control or cadence with imaging or the type of medical therapy that we might apply to try to prevent aortic enlargement, the knowledge base is empowering to our patients and families in terms of being active, very vocal, critical thinkers in their care. It is their care. I like to say the provider can be the coach, but the person playing the game is the patient and family. And all we can do is empower them with the type of knowledge base that allows them to be most successful in that journey.
Okay, Stacey. So, we're talking a little bit about the primer itself, sort of as a tool. What are your recommendations in real life, right? Because again, I know you field a lot of these questions, as you've said. When people want to go approach their provider because maybe they read something in the primer that's of interest, they're worried about something, they have questions about a particular variant. How do you suggest they begin that conversation? And if they're stuck, how can the foundation help?
Okay, so a lot of great questions. I even just wrote a couple of thoughts down. Um, I want to start out by mentioning that the primer itself it's very big, right? There is a lot of information in there, and not
Mhm.
all of it is going to be relevant to each person living with Loeys-Dietz. So just kind of start with that knowledge, right? It's like 30 pages, but a lot of that is extra and beyond what you may need to kind of focus on in your own life. Okay.
Right, right,
I would say, read the beginning part and look at that introduction because it's a great overview. And then, you don't need to know every single piece of that primer, even the parts that are relevant to you off the top of your head. That's why the
right.
primer exists, right? For you to go back and reference it as you need to. It's not a novel, okay? So it's a guide. So read those sections that are most relevant to you and your situation, right? Like the cardiovascular care, allergy and immunology, orthopedics, pain management. So take a look at the things that are most relevant to kind of what you're experiencing in your life. That's what I would prioritize.
Mhm.
And then, kind of after you've tackled those most like imminent issues in your life and you want to take a look at the other more in depth at the other sections, it can kind of help mentally prepare you for some things that you may experience because you might not have any orthopedic issues at this point in your life, but
Right.
maybe as you age, as you change, even like what you do for physical activity, your
Mhm.
experience it with what's happening orthopedically changes. So then you can go back and take a look at that. I always recommend, and the foundation does a really good job of recommending that you like create your own personal health summary, right? Make sure that you have access to and maybe even a copy of your genetic test results. That's
Mhm.
really helpful because a lot of folks are going to be looking at this primer and they're going to see a lot about the different subtypes and the different variants, and they may not know quite yet what subtype they have. So get yourself familiar with that because that's really important as you read the primer. There are recommendations based on each variant. Make sure that you, as a part of your health history, have those genetic tests. Also, if you have access to any prior imaging that you might have had,
Ah,
echocardiograms, CTs,
mhm.
MRIs, we think it's a great idea to also have like a list of your current medications that you're taking and write them all down. Even those over-the-counter multivitamins or supplements, those are really important for your providers to know. If you have a surgical history, you're going to want to make note of that and bring that with you in reference to your care. And also, I think it's really important because as you read the primer, you see a lot of reference to family history
Right.
because some recommendations around when you might want to be considering having a surgery are based not just on your variant and not just based on your own imaging, but also if you have a family history like of aneurysm or of dissection.
Yeah.
You asked more questions, but I'm going to stop there.
No, those are
Um,
all great answers.
okay.
And if folks need some help with that, there's a few things, right? We do have at Loeys-Dietz.org, we have some templates and things folks can use to capture some of their history, some of their emergency information,
Right.
correct? And
Absolutely.
yeah, you can also go to marfan.org/ask and get the Help and Resource Center team. If you're kind of trying to work through all this, it's a team of nurses. We have a bilingual specialist, not for urgent medical things, not for emergencies, but you'll hear back in about a week, if not sooner, from folks if you pose a question at marfan.org/ask. And that covers Marfan, Loeys-Dietz VEDS, and related conditions. We also have the Marfan Foundation Community Companion, and that's marfan.org/community companion. We'll put all these down below when we post. But that's an AI aggregator that includes things like the primer, all the information and resources that are on our websites. So, Kim, from your standpoint, when you've got your clinician hat on, what are some of the things community members can say that will make you more receptive to looking at a resource like a primer, right? We know that sometimes people come with kind of Dr. Google, and that can be off-putting to some providers. So, do you have any tips for how a community member can be taken more seriously when they present with something like a primer, that this really is expert information?
Well, I totally agree with Stacey about coming into the visit really prepared
Hmm.
with, this is my diagnosis, this is my genetic variant if I have it. Uh, these are the testing things that I've had done over a period of years. Um, this is an up-to-date list of my medications. Um, and especially come with questions, right? And I
Hmm.
love my patients who show up with a piece of paper or two that has enough information to have a really good immediate sense for their overall healthcare journey, their
Yeah,
meds, and their key questions. If it's 5 pages long and it's a 20-minute visit, their eyes will glaze over, right? And so one of the challenges is to prioritize, if I have 30 minutes with Kim Eagle, what do I want to make sure I don't miss in terms of leaving the office today?
right,
And as much as you might think that the material is available on an EMR, it may be very difficult to access a CT scan or something that they had elsewhere. And just even a paragraph or two summary of the key findings from imaging, especially recently, I find to be very helpful. It's really hard for me to surf the EMR when I've got a brief visit with a complicated patient. So ironically, the more the patient and family can simplify that visit around key milestones that we want to make sure we don't miss,
yeah,
their visit will be more successful.
that is great to hear. Well, as we kind of draw to a conclusion, just final thoughts. We talk a lot on this podcast about what gives us hope. When we think about an update to something like the primer, I'll go to you, Kim, and we'll give Stacey the last word on this one. What gives you hope when you look at an update like this in terms of its impact for our community members?
Well, first of all, I think it's a magnificent document written by the best minds in the world around a rapidly changing area of medical care. I love some of Stacey's comments about the fact that it moves us beyond just survivorship to thrivership, and how patients and families can live their best life with a given condition. And some of those areas are soft science, so we end up with expert opinion and shared experience. That's fine. That's way better than we don't know, right? So
Right.
I think it's a magnificent document. And I think it's going to have immediate impact for our members.
Stacey, how about you?
Well, there's so many things that give me hope because of this primer or along with this primer. One of the things I would say is that Loeys-Dietz syndrome is no longer viewed as much as a mystery disease, a mystery condition, right? That has a name. We know that these different genetic variants can all lead to symptoms within the syndrome. So that's a big one for me. And then I also look at the number of people that contributed to this primer, and that
Yes.
gives me so much hope, right? There's such a growing community and network of expertise. And look, there's a lot of names on that list that I know that are some of my family members' doctors, some people who are really great friends of the foundation, but then there's others who I don't know as well. And seeing those names show up just makes me feel so hopeful for our future to know that other people have taken an interest in my own medical care, because I'm taking this very personally.
Yeah.
It just brings me a lot of comfort and joy to know like that there is such a great future ahead in terms of our care. Like we're only really scratching the surface.
Well, Stacey, we are so lucky at the foundation to have you leading our programming, not just for Loeys-Dietz, but also for Marfan syndrome, and to bring not just your amazing professional talent, but also your lived experience. So thank you for all you do and for being with us today. And Dr. Eagle, as ever, we'll see you next time on No Connect Thrive, as well as our audience. We look forward to talking with you again soon. Take good care, everybody.